Minister, when this government got into power in 2020, your programme for government promised a statutory home care scheme along with various other commitments for fair and affordable home care, removing inpatient charges and medicine costs. Further to that, in 2022, Minister, you committed to its implementation by 2023. Yet here we are, more than halfway through 2024, and close to the end of your 5-year term in government, and what have you delivered? This scheme seems to be plagued by the same thing as the National Children's Hospital: delays, delays and more delays. Confirmation yet again of empty government promises and platitudes with no substance. Ireland's people are growing older, Minister, with the Institute of Public Health predicting the number over 65 to top 1.5 million by 2051. If this bill were to deliver on all its government's promises, our older and ageing population could look forward to being supported to live in their own homes with equitable access to high quality and regulated home care. We expected a fair deal type scheme tailored to suit the needs of the home care system, which would deliver universal home care, enabling more people to age in place in their own home, relieving pressures on hospitals. What we got is more akin to a licensing scheme for private providers than a fit-for-purpose statutory home care system. Instead, what we have after 4 years is a scheme funded on private provision of care, contradicting the universal, accessible and affordable home care scheme committed to in your programme for government in 2020. This could not be further from the fundamental sláinte care principles that more care should be delivered in the home, enabling ageing in place for longer. The care of our elderly cannot and should not be commodified by being reduced to a bottom line, minimum cost, maximum profit issue. The move from the race to the bottom lowest cost tender model to an authorisation based one is welcome. The pricing set by the HSE still far below the level necessary to attract and retain qualified staff in the sector, but regulating providers isn't enough. We need a system that is statutorily funded, recognises different levels and complexities of care, and is something our present and future generations of elderly can trust will be there when they need it. In 2021, Minister, a report came into home care regulations. HICCAV stated, every citizen of Ireland or someone close to them will need some form of support in their own home during their lifetime. As such, it is no longer viable to apply a directionalist lens towards the provision of home care. Rather, there needs to be a complete overhaul of the home care sector. That was from HICCAV, Minister. Home and Community Care Ireland, in their Rent Progress Report on statutory home care, referred to the home care sector as the Cinderella of the healthcare system. Due to the lack of progress and to the Department of Health's failure to give timelines for the scheme's implementation. This is unacceptable so many years after government promises and commitments were made, and it would appear quickly have been forgotten. Government have effectively dropped the ball on this. The scheme as it stands is at its best a licensing scheme for providers. It does nothing to deliver desperately needed reform and highlights the lack of joined-up thinking and communication between governments, departments. It is light years away from the complete overhaul HICCAV have called for. Our ever-increasing age and demographic needs to be acknowledged, and the foundations for a fit-for-purpose, statutory, universally accessible and affordable home care system put in place now and not later. Action now will ensure our future older generations, that means you and I, Minister, can look forward to being able to age in place in our own homes for as long as we are able to, and hopefully supported by a genuine public health and social care system. As Sinn Féin spokesperson for older people, I am well aware of the current failings of our home care system. Thousands on waiting lists for home care, 3 million home care hours lost in 2023 due to staff shortages. Elderly people languishing in hospital because home adaptations haven't been done, to elderly cancer sufferers caring for their sick spouse because there are no staff to deliver the home care package, and all because of a HSE recruitment embargo. These are the harsh realities being faced by our vulnerable senior citizens, Minister, because the system as it stands is dysfunctional at best. What is needed is a statutory home care system to deliver accessible, centred, fair and affordable care, giving people the opportunity to stay in their homes, knowing the supports they need are there for them and not to be forced into residential care by default. Now, I know you have said you prefer to see people aging at home, and I take that on board. A system which lives up to the expectations of your promises and commitments in your programme from government, and this bill doesn't even come close to that. We in Sinn Féin would deliver as set out in our priorities for change in health and social care document. We are committed to delivering the right care at the right place at the right time. This means putting measures and supports in place to allow older people to age in their homes for longer, modernising the home support scheme, making it a statutory scheme to enable more complex care to be delivered in the home where needed. We will prioritise development at public home care services, widen the remit of nurses and other essential health professionals to deliver more and better services in the home, and reduce pressures on acute hospitals at the same time. In essence, Minister, Sinn Féin would deliver a home care scheme that would be fit for purpose, accessible and affordable, and above all provide a statutory right of access. Now, Minister, you did mention earlier in your speech that it was important during COVID to keep people home and keep them safe, and I thank you for that and I take that on board. But I must say I have asked several times in this House for a COVID inquiry as well, and to this day we have no date. I'm wondering, would it be possible to get one? Gar míle maith agat.